Jump right in. It looks like we have a lot of folks late today, which is good. It means that your offices are filled, so that's not a bad thing. We have lost 84 additional lives since last time we met to COVID-19, bringing our death toll to 17,305 Arizonans. Our case rates continue to just creep up a little bit. We're at 862, just under 862,000. And we are closely approaching that 5 million goal of COVID-19 vaccines delivered. It's really nice to see that number continue to increase. And we know that the higher we get that number, the closer we get to herd immunity. And that's when we will start seeing our case rates and our death numbers start going down. It is World Immunization Week and also National Infant Immunization Week. And we know that a lot of you are new to the immunization world. So if you're like all of us at TAPI, once you get bit by the vaccine world, you kind of stay connected to it because it's just such meaningful work. And people all over the world are celebrating vaccines in such a different way this year than we ever have before. So we wanted to welcome you all to the vaccine family officially and wish you a happy World Immunization Week. Our theme this year is Vaccines Bring Us Closer Together. And we actually have for those of you who aren't new to the vaccine world, you probably know Donna Furlong. Donna works with Banner Health now, but in her past life, did lots of things, including running the immunization program up in Coconino County. And we have worked with Donna on lots of trainings through the years, and she's just super passionate about vaccines and really good at talking with patients. So she's going to be our main speaker today, going over kind of questions that she gets and how she answers them. And Donna, I don't know if you want to just kind of unmute and say hello and wave. Yeah. And you're still there. You go.
Let me see if I can get it unmuted. Hi, everybody. It's great to see you all.
We're excited to have Donna. So, and hopefully when we talk about answering patient questions, it's really interactive because we know that you're getting a lot of the same questions, but you're also getting some pretty crazy ones. So we want to make sure that you know how to answer them. So what's new this week? You all received notification that starting May 3rd, you will be ordering Moderna through ASIIS. So you will be able to order 200 doses every 2 weeks. High volume clinics that previously received and used more than 200 doses per 2 weeks need to note that in your order. There are no changes to ordering for Johnson & Johnson vaccine. You still order that through the counties. So those are two things that are new. And the big new news since last we met is that FDA and CDC have lifted the pause on Johnson & Johnson. ADHS issued the same recommendation, and as long as information about possible risks of the vaccine are provided to the patients who want it before they receive the vaccine. So in other words, you need to give your updated EUA. So we want to make sure that we did ask Dr. Staub to log on for just a few minutes, and he's on the Maricopa County medical epidemiologist. And Dr. Staub, is there anything that you want to make sure you providers know about?
Yeah, thanks, Rebecca. Can you hear me?
Yep.
Okay. Yes. So when now that we have resumed giving Johnson & Johnson vaccine, if you are giving the Johnson & Johnson vaccine, you do need to be providing that updated patient information sheet. In the chat, I put a link to our website that includes the current information sheets for all of the vaccines. I also put a link in the chat to the message that we are asking providers who are administering the Johnson & Johnson vaccine to include with that information sheet. As many of you are aware, those information sheets are about 6 to 7 pages long, and it's difficult, I think, for the average consumer to find the change and the update in that sheet on TTS. So We just made a simpler kind of digest of that we're asking providers to include. So links to that are in the chat. We are really trying to message out that the best vaccine is the vaccine that is made available to you. And if you are a person who has a hard time getting a 2-dose series, or just your first option to get a vaccine is with the J&J vaccine, we do believe it is safe, and are encouraging providers to give that message to their patients. So I think that is about all. And if there are any questions, I'll stay on, Rebecca.
Thanks. Anybody have any questions? And you can chat them in or just unmute yourself. We did get one ahead of time, Dr. Staub, about patients who are on blood thinners, or what's the deal with that?
Yeah, there's, I actually just finished writing an FAQ that will be updated on our website shortly, but there's no contraindication to not giving the Janssen vaccine to patients who are on blood thinners. The question is part of the pre-screening for all the vaccines. If you are on blood thinners or have any kind of anticoagulation problem. And that's really so that providers know that you may be at risk for prolonged bleeding after the injection. The American Society of Hematology did put out a statement this week specifically citing that there's no reason not to give the Johnson & Johnson vaccine to individuals with coagulopathies or on blood thinners. So again, I included all of that in the FAQ that I wrote up, and I can post that here as well.
That'd be great. Anybody else have questions or comment? Donna, did you have something on the Johnson & Johnson?
Nope, just that.
Is anybody getting questions about it, or concerns, or hearing anything? Just out of curiosity, I've only talked to one person who did. So, and most people that I talk to kind of say it's, 1 in a million. So no, they'd rather have the 1 dose.
I think for me, Jennifer, kind of goes in spits and fits. We get a whole bunch of people who are really worried about it, and then we get people who they just want the 1 shot. They don't want to mess with 2.
Yeah, that makes sense. That's kind of the same thing we're hearing. Just curious if anybody else is seeing that in clinics.
At Wesley, we had patients completely cancel all vaccinations at first, but we are having people coming back and get vaccinated. They wouldn't even take Moderna at that point because of the fear.
Wow. But they're coming back, you think?
Yeah, we still have been vaccinating, but I feel like it's a lot slower paced, if that makes sense.
Yep, it does. I know that at TAPI, we're going to start working on some materials for J&J. One of the things that we have found is when you're talking with a patient or a partner, if you're doing like an employee clinic or something like that, don't assume right off the bat that people have concerns. So when we're talking to a partner or a patient, ask them, or especially a partner if you're doing an employee clinic or something, ask them, do you have a preference on which kind of vaccine? Don't start that conversation by saying, we know Johnson & Johnson's been in the news and we know there's some concerns, because a lot of people are finding that most of their families kind of think, yeah, it was something, it paused, but I heard it was only 15 people and I'm not that worried about it. So we do need to always trust that some of our patients do read the information we want them to read on cdc.gov or whyimmunize.org, and not just, on Facebook. So, but we are going to start creating some resources to help. So let us know if you have specific questions that you want us addressed in those resources. And that is what we're going to talk about today, is talking with patients. At about 12:30, Maggie Macias from ADHS will be logging on, so we'll be able to get all of your ASIIS questions answered. I do see that there's a question already in the chat about ordering Moderna via ASIIS, so we'll make sure to ask her that when she logs on. And Donna, I think I will turn it to you. And we're having some computer problems, so we're going to hear Donna saying next slide sometimes.
I know it's everybody's favorite thing to hear somebody say next.
Yeah.
So I'm going to go ahead and go to the next one. So I know one of the questions that we hear a lot, even from our own staff, is how long is this going to last? Am I going to have to get a booster? What's the deal? And the bottom line is we don't know. Just like all the things that we didn't know about COVID and still don't know about COVID, we don't know about the vaccine either, but we continue to study it. We do know that the risks of getting COVID are much higher than the risks of any of the available vaccines, even with what we've learned about J&J in the last couple of weeks. And so we still want to encourage people to get that vaccine and really weigh their options on those risks and benefits between the Johnson and Johnson and the Pfizer and Moderna. Go ahead. And as we go through these, if something triggers you and you're like, oh, I heard this and it's slightly a tweak on what we've said or what we're talking about, please speak up, because we'd love to hear what you're hearing out there. I know in my own family, I have members and it just kills me. I think my son does it to me on purpose. But if it's not 100% effective, why do I care? And that's true. It's not 100% effective. Very few of our vaccines even approach 100%. J&J is about 67% effective in preventing the disease. Pfizer around 95, Moderna around 94. But all three of them are nearly 100% effective at preventing severe disease and death. And that's the important thing. You know, as you're going through and hearing these questions about COVID, with the exception of the first one we discussed, these are not different than what we hear about all of our other vaccines. We have the same question about flu every year. If it's only 50% effective, why do I bother? And I know that, you know, we talk about this every single year, this repeated insistence, please, 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 please get your flu vaccine. And this is the same. Although this one will be a little more effective than what we've seen in the flu in the last few years. So go ahead. My favorite one, my favorite one that comes up fairly frequently is don't get that vaccine, there's trackers in it. The government put trackers in. And this is somewhat unique to this vaccine, but not entirely unique. We've heard this throughout the years here and there about trackers being in the vaccine, and you just don't know. And this one's hard because the person who's spouting this and has this question in mind, you may not be able to ever convince them. But don't let the fear of not being able to convince them or the fear of getting into that conversation stop you from telling the truths that you know. Again, this is like every other vaccine. We've heard all kinds of myths and misnomers over the years about every vaccine out there. And what we have to do as the vaccine community is continue to tell the truths we know and don't shy away from having those conversations, even though they might be a little hard. Have them anyway. Tell the truths you know. Don't get into a battle about politics and trackers and all of that. You know, just tell the truths that you know.
I think, Donna, too, because there's a lot of folks who are new vaccine providers that have jumped in to help us with COVID.
Mm-hmm.
For you to know, this is not a new.
It is not.
Yeah.
It is not. Because of the way it rolled out, I think it has a little bit more of that attached to it, just because it rolled out so quickly. There wasn't all the studies, there wasn't all the ramp up. It literally went from not existing in November to existing in December, and boom, we were giving it. So I think in some ways, some of the conspiracy theorists that we have out there are going to attach this particular misnomer to this vaccine just because of the way it rolled out, but it isn't new. It isn't new. The big thing is that you never know what seeds you might plant for not just this vaccine, but any vaccines. This is my father. God love him, but he got his second vaccine yesterday and he just wants to get together and have a party. He lived through the time when vaccines were just starting into being. So he tells the story frequently to me of going to see his friend in an iron lung. And I think I've heard that story about 5,000 times. And, you know, he's never told it one time that he hasn't broken down and cried. So in his mind, I got my vaccine, I'm good to go. And what we need to know about all vaccines is the second you take it is not when it's good, right? It's not the plunger hitting the hilt of the needle that makes the vaccine work. It's the time in the body. So we're still learning how this vaccine works and how it prevents the spread of COVID-19. And so we've got a lot of learning to know, a lot of learning to do around that vaccine and what happens in the spread of the vaccine. But what we do know is that you still got to wear your mask in public. You still got to stay socially distanced. You still want to avoid crowds in poorly ventilated spaces. And please, if you weren't already, please continue to wash your hands. I had a conversation with somebody the other day about how all this hand washing is making my hands raw. And I said to them, that's great that you're washing your hands so much, but is it really that much more than you used to? So just consider that. Don't stop washing your hands just because the threat of COVID gets better. Continue to wash your hands because that's always a good way to prevent disease. Go ahead. And remember that people are not fully vaccinated until at least 2 weeks after the second dose of the Moderna and Pfizer, and until at least 2 weeks after the single dose of J&J. And remember that when we say fully vaccinated or the vaccine is fully effective, it's to what that vaccine can do. So we're not saying in 2 weeks from J&J, you're 100% covered. Remember from our previous slide, 2 weeks from J&J, you're 67% covered. And 2 weeks from Moderna or Pfizer, you're 94 and 95% covered. So still remain vigilant on those masks in public spaces and still remain vigilant on, you know, public social distancing and all of that.
Yeah, I think it's important too for providers, you know, all of these things about mitigation are things that you want to make sure you tell your patients before they leave. Don't tell them this before they get their vaccine.
Yeah.
They're nervous or they're excited. You know, either way, they're not retaining anything that you say. So at the end of that visit, when you remind them for the, you know, 20th time about having to come in for their second dose, that's when you remind them to do mitigation. And look at CDC as the data continues to come out.
It does.
CDC will continue to update what we are and aren't, you know, allowed to do with masks inside, outside. There were changes again this week. So those things will continue to change. So just be sure that you log on to CDC and look for those resources. And they're actually doing a good job of creating cool infographics and things.
And watch where your state is or your region is, because I know for Maricopa County, we went from green a week ago to now we're back to yellow again. So that changes everything in our practices. We went from only using shields and eye protection when we had a suspect case to now we're back to doing it with all patient contact again. So make sure that you're staying on those websites and you're keeping up with where we're at and what's happening in the area that you live in.
Really good. So this is one that we hear all the time. Natural immunity is better. We hear this in pediatric vaccines a lot too, that, you know, parents think that if their kid, you know, my grandparents got measles and they were fine. So that natural immunity must be better. But how are you addressing that with COVID, Donna?
Well, I think you have to find out, you know, tell me more about that. How do you understand that and try to really understand where they are in their role in that? Because again, if they say, well, my grandparents got the measles and they didn't die, well, then I have to really be talking about measles. And then we have to talk about, then we can get it around back to COVID and, hey, you know, let's think about what that means, because we don't know why some people get super sick from COVID and other people get a little sniffle. We don't know what that is. We can't, there's no correlation at this point with the knowledge that we, excuse me, with the knowledge that we have that tells us, hey, we know that if you XYZ, you're going to be fine. But if you ABC, you're going to die. We don't know that. And we don't know that with a lot of the diseases out there. So we want to make sure that we're continuing to talk to them about the fact that vaccine is safer. With the exception of a few rare instances, we know what the vaccine's going to do. Generally speaking, we know it's probably going to give you aches and pains. It might give you a fever, but we know in somewhat of a controlled manner what that reaction is going to be. We don't know what that is when it happens with the disease. If you get sick, sometimes you're sick before you know it. And again, that goes for all of these diseases, right? So how many people would you possibly be spreading it to before you realized what was happening and controlled it and stayed isolated? Getting COVID, we know, does offer some protection and some natural immunity, but we also know that that wanes over time, and we don't know yet how soon that is. We certainly saw people who were infected more than once in the last year. Current evidence suggests that reinfection with a virus that causes COVID-19 is uncommon in the months after the initial infection. But again, like I said, it's going to wane over time, and we don't know what that time frame looks like yet. We continue to study both natural immunity and immunity produced by vaccines. We didn't suddenly say, well, we got a vaccine, so now we don't have to look at what natural immunity is doing for us. We certainly continue to look down both lanes of this disease to figure out, how do we do this better? That's going to also help us make improvements to the vaccines over the years as we learn how the disease works naturally, to make sure that what we produce in a vaccine is going to have similar effects. So please, please, please don't shy. Again, it's that same tough conversation. Don't shy away from having the conversation because you're worried about getting into a political battle. Tell the truths you know. Rebecca, did I miss anything on there? Any other questions in there?
Yeah, I think that knowing that, I would love to hear if other folks have good tips for one another on overcoming this one, because I know we hear it all the time.
And sometimes you won't. Sometimes you have to have that conversation every single time they come to your office.
Yeah.
And that's okay. You know, I had a gentleman, I think I've told you this story before, Rebecca. I had a gentleman that would come in. He was actually coming in to me to have his wound on his foot dressed. And he was homeless. And I would say to him, did you get your flu shot? No, I'm not getting my flu shot. I don't do flu shots. Flu shot gives you the flu, blah, blah, you know, the whole 9 yards that we get from him. Well, he had to see me once a week for about 3 months. And every time he walked in the door, I would say hello, we'd talk about how his life was, and then I'd ask him if he'd had a flu shot. And finally, about 2 months into it, he said, if I say yes to the flu shot today, will you stop asking me? And I said, absolutely, for a year. I'll stop asking you for a year. And so he actually did get the flu shot. So sometimes it's just being consistent with your message and just continuing to express to them how much you care about them. And that's why you're having this conversation.
And I think for all providers to recognize that sometimes it's Donna asking that question at a wound visit that makes that person more likely to say yes when they go to their cardiologist, or you know, they're at a pharmacy checking out and are offered a flu shot. So making sure that everyone is taking the time to address those questions when you have a person in front of you who changes their mind or who just seems resistant, is going to just make things easier for the next provider that can actually get them.
Yeah, and that's a great point. And not just the providers in the room, but your front desk. What is your front desk saying to people? What is your MA or your nurse saying to people? If you don't give them the language to speak to vaccines about, then they may hesitate. And that hesitancy from them to speak can even give a message that is unintended. So really sit your whole team down and talk about, what is your passion for vaccines? What is your stance on HPV, MMR, COVID? And how would you like them to address it? It doesn't mean that that's what they have to do in their personal life, but give them the words to use with your patients. I love this one. This is also my son. I'm telling you a lot about my family today, my goodness. He won't get the flu shot because he's positive that it gives him the flu. I haven't heard so much around COVID-19 about that, and I think it's just because it's so new. But I have had a few people say, I don't want to get it because it'll give me the disease. And that's not the case. None of the COVID-19 vaccines, regardless of how they're manufactured, can cause COVID-19. So it's not going to make you sick. It might make you feel yucky for a couple of days. That's your body learning how to work with that disease. And we'll talk more about how that works later. But the same thing goes for the flu vaccine. The flu vaccine is not developed in a way that it can actually reproduce and give you the flu. MMR and varicella cannot give you measles, mumps, rubella, or chickenpox. These are all designed to simulate the diseases, but not actually be them or be able to replicate them. All right, so how do vaccines work? So vaccines, and this is just a really, really simplified way to do it. There's tons of study on this, and if you're really interested in it, I would encourage you to go and look. There's some great videos around this and everything else. But basically, vaccines are made from the same germs or parts of germs that cause disease. We take the germs, we weaken them or kill them or only use pieces and parts of them so that they don't have enough makeup to reproduce and create the disease. Once they do that, then we get them into your body, and the idea there is to is to trick your bodies into thinking that you actually have the disease that we vaccinated you for. And that activates the immune system. And once the immune system fights off what we think the disease, what it thinks is a disease, I will get my words out here in a second. Go ahead, Rebecca. That's when the magic happens. Because now it's not simply the immune system activating and learning how to fight that disease. It's the fact that while it's doing that, it's multitasking and creating these memory cells. And that's the really important piece. That's why we say 14 days after a vaccine, after your series is finished, because we need the immune system to create those memory cells so that later when your body runs across the actual disease, it goes, oh yeah, I know what this is and I know how to fight it. And it pulls up those memory cells and then goes ahead and fights off the disease for you.
I think this is for those of you who are clinicians or, MAs, nurses, doctors. Most us normal people don't understand how our immune system works at all. So a lot of times when you have someone, especially our adults who really have never opted for a vaccine, maybe they get a flu shot if it comes to their work, but because it's convenient and everybody else is doing it, not because they've actually really thought through it a lot. We don't know how our immune system works, and it's a really important thing to make sure your patients know how it works in really simple, super simple ways to explain it. And we have some really good videos and things like that maybe we can figure out. If you'd be interested in those, just chat it in and we'll dig them out for you. Anybody have other things that you are hearing? Another one that we are getting, especially for our patients who have, transportation issues, language issues, other technology issues, and immigration status. They're scared to give their ID. So we'd love to know, how are you talking to those folks to make sure that they do provide their ID? How do you do that, Donna?
Yeah, so Banner did run a fairly large pod site, so we did run into this fairly frequently. And it was really just a very simple conversation with the folks that we understand their fears. You know, you first got to meet them where they are, and let them know that we're not taking pictures of their ID. We just need to make sure that Rebecca Nevedell is really Rebecca Nevedell, and I don't have 5 of them show up in my line to get a vaccine, and I don't really know who got it. And usually if they got as far as getting to a vaccine site, you can usually talk them into giving their ID.
Mhm. Yeah, I know that's something that's come up on these webinars before too. So if you all have tips on how you make sure people feel comfortable doing that, it's going to be helpful for somebody else. I kind of think that a lot of these, for most of you, you have had a lot of willing participants to get your vaccine. So for the last few weeks, we've been starting to hear, my numbers are down. How are you getting people to show up for appointments? How are you getting people to book appointments? What are you doing with wasted doses? We've ran out of our whole wait list. You know, they're all vaccinated. And now is when the hard work is really going to get started. Now is when you will be asked to talk with people who aren't coming to you for the sole purpose of getting a COVID vaccine. So these conversations will need to start happening in a well visit, when they come in for blood work. You know, and I honestly, for those of you doing big pods still or community events, it's going to be the spouse that's with them, or, you know, grandma who got a ride to the grocery store and also popped in. You know, these conversations are going to need to start happen. We have plucked the low hanging fruit. So now it is a lot of the hard work.
Well, and that goes back to your previous question about ID. The ones that are most afraid are ones we haven't seen yet. We haven't gotten a chance to talk to yet. So it's going to be really important. Hopefully those folks that were brave enough to come, but still worried about giving their ID, have gone back to their communities to talk about the fact that this isn't about gathering, you know, data on how many illegals we have out there, or whatever the fear is.
Right.
So that's going to be really important, but also just capturing them anytime you can, just like any of our vaccines. The biggest thing I think to remember is that the COVID is new, and we're operating under an EUA rather than a VIS. But the bottom line is it's the same as all of our vaccines. Just because you're new to giving the COVID vaccine doesn't mean you don't know the answers to these questions. If you've been giving vaccine, then these are the same answers we've been given for years. It just changes a little bit because of the COVID is so new.
And we have new people too showing up.
Yep.
Yeah,
Absolutely.
Who they're all behind on tetanus.
Right.
Everything else. So another thing, just to kind of sum up, and I know we have some ASIIS questions in the chat and Maggie's on, but I think one thing I want to make sure people didn't miss from listening to Donna is, do not answer questions people don't ask.
Right.
So it really does require you to sit and listen and hear the concerns of your patient, but we don't answer questions. You know, it's just same as saying, oh, Johnson, there was a pause, you're concerned. You don't lead with that.
Right.
Yeah.
Right.
That's something that we see like a lot of room for improvement on. Another thing is really corroborating with what people say. So even if they come to you saying, I heard there's tracking devices in my vaccine, make sure that your initial response is something that makes that person feel heard. You can say, I've heard that from other people before, or I read something about that on Facebook. You know, make sure that that person knows that you don't think that they're crazy, and don't come right out and say, you know, no, that's nuts. You know, that, of course, that's not happening. Make sure they know.
Yeah.
Heard it. And then relying on those tried and true vaccine consultation skills. So, and making sure that your whole team has those skills.
Yes.
So your front desk, your whoever's that all of your MAs, not just your MAs who run your VFC program, your billing office will also get questions about vaccines. You know, everyone in that office needs to be able to have the same strong recommendation.
Yeah.
So our last new vaccine that Donna and I worked on together rolling out was HPV, and which is a vaccine that prevents lots of different kinds of cancer. And it's one of our favorite vaccines if we had to pick a favorite vaccine. But what does there's been a ton of research on HPV adherence and uptake and what gets HPV in arms, because we still have quite a ways to go. And what's all the research say, Donna, is the number one thing that drives HPV rates?
Just continuously talking to them.
Continuously talking to it from a provider, from
Yep.
your, strong provider recommendations. So, and your patients don't know the difference all the time between the MA and the doctor. So everyone,
Exactly.
once they walk in that office,
Right.
and making sure that everyone's giving that strong recommendation. So, well, thanks, Donna.
Of course.
I have one
Okay.
question for Donna that has come up a few times, and you may have said it, but I was glitching out there for a little bit. I keep hearing about shedding the virus. Like, my husband can't get the vaccine because I'm immune compromised, and he's going to shed the virus and give it to me. And this keeps coming up over and over and over again. Can you touch on that?
Yes.
In Florida, that letting teachers in if they had vaccines because of that.
Oh my goodness.
Yes.
Oh my goodness. Okay. So yeah, viral shedding is a thing, but not for COVID. Viral shedding was a thing for oral polio, which was a live virus. And then also somebody pointed out to me earlier today, also for the smallpox vaccine, neither of which we give in the United States any longer, partially because of for the oral polio, partially because of that issue, for smallpox because we've eradicated it. So it's really only given to our military folks at this point. But viral shedding doesn't happen with the vaccine, with the COVID vaccine, or any of our non-live vaccines. In fact, it's not even MMR, and varicella is a live vaccine, and it doesn't cause viral shedding either. So we just need to continue to, again, meet them where they are, try to understand what their worry is. So in the example that Jennifer gave, I'm immune compromised, so I don't want my husband to get the vaccine. Actually, what I would recommend is that person talk with their immunologist, because I want that person to get the vaccine. And I'm sure their immunologist would probably say the same thing, in addition to the husband. So really take a moment and find out what is causing that. I've heard similar things with my daughter is pregnant. I don't want to get the vaccine because of the shedding. And again, I want that daughter to get the vaccine for a variety of reasons, in addition to the grandparent. But for the daughter, we've already seen that we're able to pass some COVID immunity down to the babies. And that's really exciting data that's starting to come out of all the studies that we're doing. So it's really, really important that you understand what's driving that fear so that you can really have a good conversation about it.
I also recommended for somebody who just absolutely can't get the vaccine, that's when you want everybody around them to get it. You want to cocoon them with that protection. So if they absolutely can't get it and their doctor said no, then the husband and the grandparents and parents and neighbors all need to make sure they really get it, because you've got to protect that immune compromised person.
Absolutely.
All right. So as you continue to get questions, just remember to use this space to get ideas about how to answer them. And we still have resources on, as we start to work with communities who we have not been reaching, they haven't been able to access the current systems. Now we're getting down into smaller communities that have unique barriers to accessing all types of care, including COVID vaccines. So we fully expect that we'll start hearing things again about safety. We'll start hearing things again about it came out too fast. All of those things that we heard really early on in the process will probably bubble up again. So make sure you're refreshing your talking points, and your whole team is refreshing your talking points when you do your morning huddles. Go over, some hesitation that they get to make sure that everyone knows what to say. And we will talk a little bit now about just kind of open it up of what other questions do you have? And Maggie, I think you're on the line, right?
Yes, I'm here.
Hey, okay, I'll kick it off because we got a question early before you logged on. So we talked about now they're going to be ordering Moderna as of May 3rd through ASIIS, 200 doses every 2 weeks. And if they need more than that, because they're doing a mass clinic, they write it in their notes. So there's a question about how do they do that? And is it in IPO train?
Yes, so in your comments section where you're going to place the orders, I'm going to actually add the link here
Okay.
in the chat to everyone. And this document will show you how to place your orders in ASIIS. And in one of those slides, it tells you to add your comments. In your comments, you can add what you physically have on hand. And I believe it's slide 3 of that link that I sent. That is where you will indicate how much you physically have on hand.
All right. And then we had, can they order, another question came in about ordering, can we request specific vaccines? So so if you're ordering, if you are not part of the federal program, so you're not an FQHC, you're not a pharmacy getting federal stock, you can request J&J from your counties, and you can request Moderna from your counties today, but starting May 3rd, Moderna from the state. Is that correct, Maggie?
I don't want to give a definite answer on that. You would have to email the Arizona VFC to confirm that. I'm sorry.
Okay, so we'll get that. Jen, can we make a note to get that in writing? Okay, so we'll send that out on Monday. And then penalties for wasted doses. We had someone ask if they're starting to get people that cancel appointments or don't come. Are they going to be penalized for wasted doses? Is there consequences from the agency when vaccine doses are wasted? That's the question.
So I think they're talking about the dose-to-dose restitution.
So this is COVID only, not VFC.
I don't have the answer to that as well. We probably have to get back to them.
Okay, so we'll dig that out and go over that next week. The FQHCs are also ordering through Moderna through ASIIS, correct?
I will get that answer from the VFC.
So I don't know, is it VFC running the COVID vaccines too?
They are both running the COVID and everything. It's all tied in one. It's one department handling it all.
Okay. So I think that all providers, I think this is the right way to answer this question, Chris, is that all providers as of May 3rd who want to request Moderna vaccine will request Moderna vaccine through ASIIS. You will be able to request in 200 doses every 2 weeks. And if you need more than that, you will put that in your notes. And your J&J requests are the same. You still do that through your county. So FQHCs and pharmacies have other places, they can request vaccine from the feds too. So that's maybe where we made that confusing. Do you understand that differently, Maggie or Jen? Jen, you're on mute. You're still on mute.
Yep, my whole screen just crashed. There it is. Yeah, from my understanding, if you're working with the county to get your allocation for Moderna, that allocation is going to switch over to ASIIS. So you won't be working directly with the county on the Moderna, but you'll still work with the county on J&J and Pfizer, or through the federal program, you'll continue to work through those as well. It's just the Moderna doses. Instead of it routing through the county, it's going to go through ASIIS. And eventually these vaccines will just be in ASIIS.
So I do have Angela logging in from our department. She actually handles the ordering information going on, all the questions that you're asking right now. Okay. She must have not gotten the link, so she missed the meeting, but she's logging on now.
I can hear you. I'm so sorry. It wasn't in my calendar, and just go down the list of meetings in my calendar. What's the question? I'm happy to help.
So Angela, we're getting a couple questions around ordering. So ordering in ASIIS, how do we do it? Maggie provided that for ordering for Moderna doses. Mm-hmm. Can they request specific vaccine still from the state and or counties?
Yeah, so that's a good question. So the Pfizer doses and the Johnson & Johnson Janssen doses will still be allocated through the local jurisdictions, through the county health departments and tribal jurisdictions. So if the county is partnering with someone to give either Pfizer or the Johnson & Johnson, then they would get their doses allocated through the county. It's just the Moderna doses that are plentiful enough that we can open it up for the average, I don't want to say average, for whatever provider may need them to go ahead and order. And they can order up to 200 doses every 2 weeks. If there is a provider who has been in the past receiving Moderna doses from the county health department allocations, and it was more than 200 doses, perhaps they partnered with them to do a specific pod, then they would just note that in the ordering system, and the county will let us know who those persons are that they've been partnering with in the past that would need more than the 200. One of the things that's really on my mind lately is a lot of the pods, we've even been seeing thousands and thousands of patients per day, are dwindling down to see not very many patients per day. So I really want to forewarn people, before you order the Moderna doses, make sure that you have a plan in place to be able to administer those doses.
Mm-hmm. Okay. So everyone orders their Moderna through ASIIS.
Correct.
For Johnson & Johnson, they continue working through their counties.
Correct.
So we had other questions around wastage. So is there a penalty for wasted doses? The clinic was starting to experience no-shows and that wasted doses for COVID vaccine.
I don't know what the penalty would be. It's a contract that, keep in mind, even though you're going through ADHS, it is a contract signed with the CDC. So I don't know what the penalty would be for wasted doses. I would just not plan on having, do whatever you can to not have wasted doses. Only order exactly what you need. Make sure, to avoid wasted doses, make sure that your site is on the CDC's vaccine finder website so the public can find you. Just make contingency plans. That way you can make sure that you do give the vaccines. Keep in mind, even though the US may have at some point plentiful amount of vaccines, the global world doesn't. So we do not want to waste vaccines that could be used.
So we're not aware of any penalties, but if there were penalties, they'd come from CDC, not the state.
I don't know how it would work. The CDC would have to tell us what. Yeah, I don't know how that would work. If it would come from the CDC through us to them, or I don't know.
I wonder if we'd be able to dig that out. Maybe Jen and Angela and Maggie, maybe you guys can hook up about that. Because there's a bunch of questions I'm getting privately and in the chat about this.
Yeah.
So maybe we can try and get some clearance for you guys in the next week. Do they have to record wasted doses when ordering vaccine?
Yes, you have to account for every single dose that is shipped to you. So if a dose is wasted, then you do mark that in ASIIS that it was wasted.
Okay.
Is that when you're placing orders, or is that daily, or is it happens? I may have missed that.
So ASIIS will physically require you to do inventory reconciliation before every order, but you should be doing it more often than just right before you order. I would do it as it occurs. So if you waste a dose today, then I would go in there and you'll need to contact us. You'll fill out a wastage report, and then you'll document that in ASIIS as wasted. I would do it as it occurs. I wouldn't wait until. But if you do wait, then whenever you go to order vaccines, the ASIIS reconciliation screen is the first thing that pops up. And you would need to do it there to make sure your inventory is accurate.
So Jay's asking, what website do we go to order J&J? That depends on the county that you're in. If you're in Maricopa County, you were sent a link where you make all your requests for COVID vaccine. I think PEMA, they're having them email, right?
Yeah, PEMA has an email link, and Maricopa County sends a list to all Maricopa providers. So it really depends on the county. Every county has a different system. Some of them are, you call, and some of the smaller counties. So let us know what county you're in, and I'll see if I can't find at least a contact for you.
So will we know before the end of the year when we get our wastage report, so we are not liable at the last minute for over 5%? I think, is that a VFC?
Yeah, that usually applies to VFC. So the VFC program providers get wastage reports, and the VFC program providers get, well, the state as a whole, not providers, but the state as a whole gets a grace of 5% wastage. So for the VFC program, we do give providers quarterly reports so that they know the percentage of doses wasted, and if they exceed a certain amount, then they are required to replace those doses. The challenge with applying that to COVID-19 vaccines is COVID-19 vaccines aren't for sale on the private market. So a provider wouldn't be able to just purchase them to replace what they wasted. So that's partly why I say I don't know how CDC will handle wastage for COVID-19 vaccines. I don't think it will be on your same VFC report because they're two separate programs. There's a VFC program, there's a COVID-19 vaccine program. So I don't know that you can apply what we do for VFC vaccines to the COVID-19 vaccines at this point.
So maybe when you and Jen get some clarity from CDC over the next week, can we just make sure, because there's some questions in here about, will my COVID vaccine wastage affect my 5% for my VFC program? So let's just make sure we get that in writing for them too.
Yeah, it's a great idea to get answers to that.
So I'm needing more guidance with ordering for the first time in the next couple of weeks. Also, are we able to order vaccines just for our patients, or will you be giving us the SNF group home AL list to give the vaccines? I'm actually not sure what those lists are. Are you, Jen?
No, I was kind of trying to figure out. So if you're one of the contractors working with the counties to do some of those additional groups, then they'll probably continue to allocate vaccine to you for those, so that you can order for your patients that come in, and then work with your county health department if you're doing some of the group homes and long-term care. I think that's what that means.
But you will not get Moderna from the counties anymore. You'll have to order that for your patients and whatever events that you have through ASIIS.
So that's where you would put that in the chat, that you are, working to do group homes, so that you're going to need more than the 200 allotment if you have quite a few group homes scheduled. put that in the notes so that you can be allocated more through ASIIS.
Yeah, Jay, that's a really good tip, especially for smaller practices that they're doing. They're getting the names of patients that want the vaccine. And then once they have 10 patients that want it, then they schedule them. That's a really good idea to prevent wastage. I have a fly. Hector was asking about how to input things manually. And I think, Jen, did you answer that question? Did you?
Well,
Yeah,
I think he had asked if there was another way to report. So you can report manually by typing them in. You can fill out the application. I sent a link that allows you to connect your EHR to ASIIS, but that does take it takes a while to do that because it's a real specialized connection. The other option is the state has the vaccine management system, which is that patient portal where people are making appointments through that. You can sign on as a provider to use it, and that system automatically reports to ASIIS. However, you can't bill from that system. So you'll still have to download reports out of it and get that information into whatever you're using for your billing system.
Mm-hmm. Angela, if they order, now that they're ordering Moderna through ASIIS, will they still get the ancillary kits sent a week ahead of time?
Yes, so the way that the orders are shipped will still be the same. So you should get the ancillary kit. Usually it comes either the day before or the same day that the vaccines arrive.
Mm-hmm. There was a question around COVID screening. I assume that means COVID test kits. Do we know where they can get free test kits? I don't know.
Rebecca, I was seeing that question too, and I don't know that I even know that. You could reach out to some of the labs like Norquest and LabCorp and see if they would charge you, or if because you're going to send it back through them for resulting, if they would be willing to give you some. That would be my best guess on that one.
And Carly's saying contact your county, see if they have some. And Chief's in there asking, it looks like they're about to launch their effort. And did you see that one, Jen?
No, I didn't. What was that?
Is there a person or a department to call to help us set up the process, including data loggers and help with ordering and tracking? We're approved, but they're just having a hard time setting up that process.
Yeah, actually, I was just getting ready. I was just answering that, which is how I missed your question. Yeah, and I think right now, if you want to email me at jennifert@tapi.org, I'm going to see if and let me know where your office is. I can see if I can find an office that's close by that you might be able to shadow, or if anybody, if you want to let us know now, if anybody wants to jump in. And then we have a nurse consultant that does help with childhood vaccines. Let me find out from her if she feels comfortable enough about ordering through ASIIS to be able to do COVID as well. But if not, we'll find someone in your area that you can at least reach out to. I'll put my email in the chat box too.
Yeah,
and that's the same for anyone.
I know early on when we first started doing COVID tips, people kept kind of asking that question in the chat and eventually got invited to another clinic. So help your friends. They're just starting out. Try and help them set things up. But there's especially, your large clinics and your pediatric clinics have been doing this for so long. Most people are eager to help if they have time. So. Josephine saying we've had a lot of patients canceling appointments last minute, having a hard time filling those slots. I'd love to see if you all are tracking no-show rates for COVID shot only visits. That would be like really interesting to just start seeing. and just how is your throughput changing? I think that unfortunately, just like we were talking about earlier, we have picked a lot of the low-hanging fruit. Now it is time for the hard work to begin, and it's going to take a lot more, patient consultation, support with transportation, reminding patients how to get their transportation covered by Medicaid or through other partnerships. So yeah, it'd be neat to look at that, Josephine, if you could pull that. I know it's
Well,
been.
And I'll echo the same thing, Rebecca, in the last few weeks that some of our practices that, and we're in our outlying areas, we're doing Moderna. They had the same issue pop up and we're really scrambling towards the end of the day to fill those up. So just, I would echo what Maggie said, just be super, super careful when you're getting ready to do this, that you know that you can utilize those vaccines so that none of them go to waste. It's like liquid gold.
Yep. All right, well, we're at time. Next week, we are going to talk about billing again to make sure that we can all afford to keep doing this. And if you have, and maybe we'll also kind of combine some of that getting patients in the door thing, if you can get that data for us, keeping appointments. And we'll try to get clarity on wastage from CDC. We can't make promises on that. Unfortunately, Angela's close to them, but sometimes things move slower than we want to get clarification on that, but we will try and talk through ordering. So if you have other questions, we'll keep the line up for a little bit, and thanks everybody. See, Sue's doing that, getting to 10 people before they book too. That's a good idea for small practices.
Well, and if you have a few backups, the other thing you can do is if you don't need those backups, make sure that they're first on the list the next time you give.
And I would just add, just because you can order 200 doses doesn't necessarily mean you need to order 200. You can only just order 100 for if it's the 10 dose file, or 140 for the 14 dose file. Thank you, everyone.
Thank you.
Oh, and is the 14-day vial out now?
It will be out shortly. I know this week the doses being sent are still the 10 dose file, but within the next week or two, it will be out.
Okay, I thought it already shipped, and I was like, oh no, I didn't note that anywhere. Okay, good. Gives us another week.
Yeah, that's oh, and that's asking if her question. And now, what was the question again? I'm scrolling. We have a lot of scrolls.
Me too.
Oh, yeah. Recommendations
Oh.
for posting. That's a Jen question for sure.
Oh, yeah, and I'm not our social media person, but if you go to tappy.org, we have links to our Facebook and Twitter and all of those, so that if you want to just, kind of share what we have up there. And then I know CDC has a full toolkit for NIW with quite a few posts about World Immunization Week and things like that. I'll grab that link really quick and put it in there. Oh, good. Laura's on it. She's going to get us the link. She's our social media person. Thank you, Laura. And I'll get the CDC's materials for the week.
Yeah, World Health Organization stuff was really cool too. I looked at that.
Yeah, I really did like their whole, it brings us, vaccines bring us closer. Vaccines bring us together. Okay, and I'm sticking in the link to the CDC social media kit for it.
All righty. Well, I think we're quiet now. So I think we'll log off and see you all next week when we talk about billing. Bye.
Thank you, guys.